In other news, the government of France, through the French Department of Martinique, is continuing efforts aimed at weaning St. Lucia off its healthcare system. For years now, the neighboring isle has had to contend with an influx of St. Lucians seeking healthcare and not paying the bills. Earlier this year, a memorandum of understanding was signed between the two countries, giving support to St. Lucia in the form of staff training. The objective is to shore up the skill and capacity here with the new general hospital opening. French authorities hope this would give St. Lucians access and assurance in the local healthcare system. In that regard, a team from PAHO have been on island providing that training. Dr. Erica Wheeler is the PAHO advisor for Human Resource Health.
For example, how is it going to be staffed? Will there be sufficient staff? How is it staffed in relation to other services in the community? So our focus really is on the tertiary aspect of care in St. Lucia during this visit. This visit really originated with the French department because the French department is very much interested in offering assistance to St. Lucia with training of health professionals. And by that I mean particularly here at the hospital specialists. So we're talking doctors and nurses. So this visit is focusing on how do we work with the French department as PAHO and as the the ECC to support the staffing of the hospital. So in terms of hand-holding, it's more of assessing and evaluating what is needed in specialist care and how PAHO, working at the ECC level, but with the French department, can help to advise on the staffing and look where we can help to, for example, in particular with training of specialists and training of nurses, because we understand with the move from the old to the new system that there will be a need to train people, particularly doctors who need specialist training, to be able to provide it to the St. Lucian community.
Okay. Dr. Wheeler says St. Lucia has the capacity with the new hospital to explore centers of excellence or health tourism. However, there must be careful consideration given to a workable plan.
Everyone can't specialize in everything. So the idea then is with the new facility, we do have to take into consideration, first of all, the capacity of the new facility, the specialists that are available. And yes, it is brand new and there's a lot of potential, but I don't want to jump the gun and say what specialist it would be. But with every new facility, there are opportunities, but we must always be very careful that we look at what are the current staffing needs, what are the demands from the community, because it's nice to have a new hospital, but we also have to look at the utilization of the old versus the new and what is available in the old one versus what is available in the new one. So I would like to say we need to evaluate more closely because we still need to get the statistics on the utilization of the old hospital and what will be available here. We understand there will be less beds, so there will have to be some creative thinking about what is possible in terms of the numbers of patients to be treated and where can a center of excellence be.
And building capacity in specialty areas will be critical, as well as the overall cost to the system. Dr. Peter Cowley, advisor on health systems, explained.
And that not every country can provide every type of specialized care. And some discussions are being held at a higher level about this concept, and many islands in the region are beginning to understand that they can offer specialized care that could be used by citizens as well as residents of other islands. This is already beginning to become more than just a thought. It's becoming a reality. For example, in Antigua, they have a very advanced oncology center that's already providing care to citizens from Anguilla. Other islands are also considering the same sorts of concepts. In St. Lucia, we see that there is great potential for this because of the new National Medical Hospital as well as the strength of the human resources, in that the new National Medical Hospital or other facilities here in St. Lucia could offer specialized care to not only its own citizens and its own residents, but to those from neighboring countries. And what you get when you do that is you're increasing what's called universal health coverage and universal access, which the World Health Organization and the Pan American Health Organization are greatly trying to promote with ministries of health, where every citizen has access to a wide range of services at without due financial hardship to them or their family. So when you provide these regional specialized centers of care and you have agreements with sister governments, you are in effect providing more services for more people at lesser financial hardship.